May I know what is your name po?
Maria Angela M. Calibre.
So, my name is Roman Paulo Magtina and I will be your nurse for today. So, today, I will be assessing your mouth, throat, nose, and sinuses. Is that okay to you, ma'am? On your mouth problems, ma'am, have you ever feeling mouth or tongue sores, ma'am?
No.
Or how about bleeding, ma'am, or pain? Ma'am?
No.
So, how about on your sinus problems, ma'am? Have you ever experienced pain over your sinus, ma'am?
No.
Okay, that's good. So, how about on your nose problems, ma'am? Have you experienced nose bleeding?
No.
Okay, that's great. So, next I will ask about your past history, ma'am, of your illness of in the mouth, nose, throat, and sinuses. Is that okay to you, ma'am? So, on your past history, ma'am, have you experienced surgeries, or treatment on your mouth, throat, and etc., ma'am?
No.
None. Okay. So, have you used any nasal spray?
No.
Okay, that's good. History of tooth grinding.
No.
Okay, very good. So, next is, umiinom ka po, ma'am, or naninigarilyo?
No.
Okay, good, very good. And nagtutoothbrush ka po, ma'am, araw-araw?
Yes.
Okay. So, okay na, ma'am. We are done with the interview, ma'am. So, let us now proceed to the physical assessment. So, we have here a pen light or a flashlight, the cotton gauze pads, and the gloves. Oh, and the next is the tongue depressor or tongue blade, and the alcohol for sanitizing our hands. So, I almost forgot the speculum attached to the otoscope. So, ito siya. So, let us now proceed to the assessment. So, ma'am, today I will be examining your mouth, throat, nose, and sinuses. So, I hope, ma'am, you have participated to this activity or this procedure, and magsabihin mo lang po, ma'am, if may masakit kang nararamdaman. If you are not comfortable po. So, now we will take the gloves and we will use it. Okay, nasuot na natin ang gloves. So, first, we have to note the distinctive odors of the patient's mouth. So, ma'am, can you please inhale po? And exhale mo po gamit yung bibig. So, okay. So, ayun, wala naman siyang masyadong amoy. So, normal naman po ang odor ng kanyang mouth. So, okay. So, next, inspect and palpate the lips and buccal mucosa, gums, and the tongue for any color variations, such as pallor, redness, white patches, and bluish hue. And moisture and tissue consistency or lesions, such as induration, roughness, vesicle, crust, flakes, nodules, ulcers, cracking, patches, bleeding, and etc. And also, you have to know the stansen and warts and ducts. So, let us now inspect. Okay lang po ba? Okay. Okay lang po ba hawakan ko, ma'am? Okay. So, the patient's lips is pink and moisture, so which is already normal naman. Wala namang signs ng cracking. So, let us now come to the buccal mucosa. So, we will be needing this, the tongue depressor. Okay. So, ma'am, may I inspect your buccal mucosa po. So, if you are not uncomfortable po, sabihin mo po sa akin. So, buka po ang bibig. Buka po. Lakihan mo po, ma'am. Okay, double check natin. Okay na po. So, while inspecting the buccal mucosa, so there's no any discoloration, swelling on her her buccal mucosa. So, let us now proceed to the gums of the patient. So, ma'am, can you open up your mouth po, please? Pwede po lang ano po, ma'am. So, hindi ko makita siya. Gamitan natin siya ng pen light or the flashlight. So, ma'am, lakihan mo po, ma'am. Next. Ito po. Sige pa po. Okay, hindi po ba masakit? Okay. So, in observing the gums, patient, wala naman siyang discoloration and swelling lesions on sa gums niya. So now, let us proceed to the tongue of the patient for any discoloration, color variation. So, ma'am, can you please open again your mouth po? Please po, ma'am, paano po nandito po? Okay. So, laki-laki mo po, ma'am. Relax lang po ang dila mo. Yan. So, okay. And observing the tongue of the patient, so, ang color naman niya ay pink, which is normal naman. So, wala namang lesions and any bleeding. Wala namang problem ang tongue niya. So, next we will now inspect the gums of the patient for hyperplasia and for blue black lines. So, ma'am, okay lang po ba na touch ko po ang ano niya and iangat ko po siya, ma'am. Sabihin mo lang po if masakit siya. Nga ka po. Okay. Baba naman. Okay. So, in observing the gums of the patient, I didn't see any signs of hyperplasia and also wala siyang discoloration, no black lines on the gums of the patient. So, next, we will now inspect the patient's teeth for the number of the teeth, the shape, color, etc. So, ma'am, okay lang po ba na i-touch ko po ulit ang lips niyo? So, relax lang po, ma'am. Aka po. So, 1, 2, 3, 4, 5, 6, 7, 10, 11, 12, 13, 14, wait lang. So, okay ah. So, in observing the teeth of the patient, ang number of teeth niya is 29. And the color niya is light yellow, so which is normal. So, okay na. So, next, we will now inspect and palpate the tongue for color, texture, and consistency if it's black and has a white patches, smooth or reddish. So also we will inspect the moisture and the size for any enlarged or very small. So now we will be using these gas pads for palpating and inspecting the tongue of the patient. So okay na, labas mo po yung dila mo. Labas mo po. Okay, sige, lapad mo po, ma'am. Okay. So, right. Okay. So, while palpating and inspecting the tongue of the patient, so I don't see a pamamaga na sa kanyang dila and I don't see any white patches. So, normal naman ang kanyang tongue. So, okay. we are now done on the mouth of the patient. So let us now proceed to the throat. So in throat, we will now inspect the throat for color, consistency, torus palatinus, and uvula. So, ma'am, can you please po ulit? Lakihan mo po, ma'am. And labas po yung dila. So, hindi natin makita, kaya gagamit tayo ng pen light or flashlight. So, ma'am, can you please open your mouth po? So, sige pa po, ma'am. Hindi ko po makita yung... So, okay. Okay. In expecting the patient's uvula, and it is a normal size and has moist on the uvula of the patient, and the torus palatinus is, and I don't see any signs of lesions in it. So we will now inspect the tonsils of the patient for color and consistency. Grading scale of 1+, 2+, 3+, and 4+. Determine for any inflammation or any informal any discoloration of the tonsils of the patient. Ma'am, can you please open your mouth po? Pwede po lang kayo ma'am. Hindi po labas ng dila po. Sige pa po ma'am. Medyo lakihan mo pa po. So, okay. So, the tonsil has the same size and no swelling or any discoloration. So, the tonsils is hidden on the tonsil pillar. So, the grading on this tonsil is 1+. Now, we are done on the throat. We will now proceed to the assessing the nose. In nose, we will now inspect and palpate the external nose for color, shape, consistency, tenderness, and patency of airflow. So, this will help to determine if there is swelling or bleeding or any abnormalities on the nose. So, ma'am, inspect it po. So, using the right. Okay. Kaya okay lang po, ma'am, hawakon. Sabihin mo po, ma'am, kung masakit or hindi. Sabihin mo po, ma'am, kung may masakit, ma'am. Okay. Wala naman po masakit, ma'am. So, when palpating the nose, tinanong ko siya kung if may masakit. So, she said na wala naman. Now, we will check the nose for any patency of airflow. So, ma'am, here ka po. Okay, next. Nahihirapan ka po sa paghinga? So, next po ulit. Hindi ka naman po nahihirapan. So, her patency of the nose is normal. So, hindi naman daw siya nahihirapan when we breathe in or breathe out nang isa lang ang butas. So, all good, normal naman po ang kanyang nose. So, next is we will now inspect the inside of the nose. So, using this speculum attached to the otoscope, we will now inspect the internal of the nose. So, we will now inspect if there is any discoloration, swelling, exudate, bleeding, ulcers, and etc. So, now, ma'am, so, okay. Next po. Okay. Okay, double check po natin, no? Okay. Okay. So, while inspecting the inside of her nose, wala naman ako masyadong nakita ng bleeding or swelling. So, overall, okay naman ang nose niya. So, we are now done on assessing the nose. So, we are now going to proceed to the sinuses. So first, we will now palpate the sinuses for any tenderness. So this will determine if the patient has a swelling on the sinuses and if she feel any pain on the sinuses while palpating. So ma'am, I'll touch your chest po. So wala naman pong masakit ma'am. Ito. Okay. Wala naman po ma'am. Hindi po masakit. Double check ko natin. Okay. So, while palpating the sinuses of the patient, I didn't see any inflammation on her sinuses. And as the patient stated, na she did not feel any pain while palpating her sinuses. So, we'll now proceed to the percussion of the sinuses. So we will now percuss and transilluminate the sinuses for air versus fluid or pus. So we will now percuss the sinuses of the patient. So ma'am, I will now touch ko po ulit yung sinuses ninyo. And ngayon, tap ko na lang siya. Is that okay tayo ma'am? Okay. Okay. While percussing the patient's sinuses, she didn't feel any pain. So it means that her sinuses is normal. So next, we will now proceed to transilluminate the sinuses of the patient. So we will now check it, ma'am, if there any po. Laki naman po. Okay, next. Okay, po. Okay. So when I place the transilluminator against her cheekbone, so there is a reddish glow on the hard palate that indicates normal air flow sinus. So we are now done in assessing the mouth, throat, nose, and sinuses. Analysis of the data. So formulate the nursing diagnosis such as wellness, risk, and actual. So this will help to determine the nursing diagnosis of the patient. So this will help the other medical providers to determine a nursing diagnosis. And next, we will now formulate the collaborative problems. So, since normal naman po ma'am ang yung mouth, throat, nose, and sinuses, so hindi na po natin kailangan ng formulate the collaborative problems. So, and next, make necessary referrals. So, as I said earlier, na na wala namang problema sa kanyang mouth, throat, nose, and sinuses. So we also do not need a necessary referrals. So ma'am, as the findings of assessing the mouth, throat, nose, and sinuses, so everything is normal naman po. So wala naman po kayong dapat problema dahil everything is normal naman po. So we are now done assessing the mouth, nose, throat, and sinuses. So thank you.